Welcome to Ranson's Rescue Team. Today, we're diving into the world of acute pancreatitis and learning how to diagnose it using Ranson's Criteria. Let's get started. Meet Dr. Ranson and his amazing team. They're here to help us assess the severity of a patient's acute pancreatitis using Ranson's Criteria.
Hello, everyone. I'm Dr. Ranson, and we're ready to solve this case. Let me introduce to my team one by one.
I'm an old-timer. First up, I'll check the patient's age. Age is 75 years? Oh, you're in trouble. Dr. Ranson, we are giving him 1 point.
I am sorry, I have to give you 1 point according to Dr. Ranson's criteria. Where is Glucose Guy? It's his turn now, and he is always late. Dr. Ranson, you should punish him.
Hey, I'm Glucose Guy, checking blood glucose levels. Just 1 second. Here you go. Congratulations, your blood glucose came to be 180. You are safe. And old-timer, you should stay in your limits, as my job is more important than you. What do you do all day? Just asking patients. Their age is the worst job I have ever seen, huh?
Greetings! I hope you all are doing great. I'm Liver Lady, here to measure liver enzymes. So my job is to measure LDH and AST. So I took the patient's blood and measured LDH, which came E to BE, 400 international units per liter. Oh, we have to give the patient 1 mark for that. And what about AST? Any guesses? Glucose Guy? Well, it's 300. 1 point again. So my patient got 2 points. Oh well, it was a hectic day, managing 2 tasks by one thin, lean, beautiful girl. Well, never mind. Then you all say I am chatterbox. Am I?
Can you please shut up for 1 second? Until the nurse White comes. So, Dr. Ranson, up till now, we have 1 score for age, 1 score for LDH, and 1 score for AST.
Just coming. I just forgot my counting, so I have to start it again. So, friends, I am Nurse Whitey, and my task is to measure those tiny white blood cells. If the patient's white blood cells are more than 180,000 cubic millimeters, then we give our patients 1 point for Ranson's criteria. So this patient's white blood cells are in a range of normal, which is 4,000 to 11,000 cells. So let me tell you, the 5 points which we have to measure at admission of the patient are: number 1, age; number 2, blood sugar level; number 3, serum LDH; number 4, serum AST; number 5, white blood cell count. So you can read these points, and we have also made a wonderful mnemonic for you guys. Are you guys ready to unlock the mnemonic? Yes? Here it is, friends.
Alas. 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 Alas.
Now it's time for the 48-hour criteria. Our dear Dr. Ranson has made another team to assess the severity at 48 hours. Let's get introduction of each hero of the team.
I'm Calcium Cat. Calcium levels are crucial for many bodily functions, including muscle contractions and nerve signaling. Is the calcium level less than 8 milligrams per deciliter? Absolutely, it's 7. This can indicate a severe inflammatory response. Excellent. That's a point for our patient. Calcium levels can drop because the inflamed pancreas releases enzymes that cause fat necrosis. This process binds calcium, leading to hypocalcemia.
I'm Hematocrit Harry, checking hematocrit levels. Hematocrit measures the proportion of red blood cells in the blood. In acute pancreatitis, a drop of more than 10% can indicate severe bleeding or significant fluid loss due to inflammation and capillary leak syndrome, where fluids and proteins leak from blood vessels into surrounding tissues. Let's see. Has it dropped more than 10%? Indeed it has. That adds 1 point.
Woof! I'm Deficit Tube, sniffing out the base deficit. Base deficit measures the amount of excess acids in the blood. In acute pancreatitis, metabolic acidosis can develop due to poor perfusion and tissue hypoxia, leading to a base deficit greater than 4 milliequivalents per liter. More than 4 milliequivalents per liter. Yes, we have it. That's one more point for our patient.
Hi, I'm Bumburger. Looking at blood urea nitrogen or BUN. BUN is a measure of kidney function and hydration status. In acute pancreatitis, an increase of more than 5 milligrams per deciliter can signal kidney stress due to dehydration or shock. Increase more than 5 milligrams per deciliter? Yes, confirmed. Sorry, my butt. It was actually more than 2 milligrams a deciliter. Still, the BUN is more than that. Shrey, we got 1 point.
Hey there, I'm Fluid Fred, tracking fluid sequestration. Fluid sequestration measures the amount of fluid that's been lost from the blood vessels into the tissues. In acute pancreatitis, severe inflammation can cause significant fluid loss into the abdominal cavity and tissues, totaling over 6 liters. Over 6 liters. Yep, spot on.
Woo-woo! I'm Oxygen Owl, measuring arterial oxygen, or PaO2. Oxygen levels in the blood are vital for organ function. In acute pancreatitis, inflammation and fluid accumulation in the lungs can lead to respiratory distress, lowering PaO2 levels below 60 millimeters of mercury. Let's check. Below 60 millimeters of mercury? Correct. All right, team, let's do some quick math. Here, ready? 1, 2, 3, 4, 5, 6. Oh, look at that. We've scored more points than a basketball game. With more than 7 positive criteria, this indicates a very high severity. The patient needs immediate attention. Now, you can also give this slide a red or take a screenshot. Whatever you like, it's up to you. So now, who needs a mnemonic to stick it to the mind with a glue? Probably everyone needs one. Okay, on the count of 3. 1, 2, 3.
Harry bought cake, but only frosted. Harry bought cake, but only frosted.